Hi, I'm Dr. Julie Steinauer, and today again I'm sitting in front of a brand new kind of cool toy that we have. Now this box is not new to our office, we've had it for quite some time, but we got a new little toy that goes along with it. These are called M.I.T mazes, and I'll just show you. There's a bunch of levels of difficulty. This is the most basic. It gets a little bit more tricky with this. Third level of trickiness. And then here we have the most complex or most difficult level up here. So our patient would have one eye viewing this box, the light's on in the background, and then I'll just show you what happens. We turn it on. Okay, so it has a motor that spins this little thing on the inside, and it creates like a little propeller that moves around. And when the patient is looking at this, they can see that little propeller moving around. And their goal is to move the propeller through the maze from the beginning to the end of the maze and not allow their eye to ignore the propeller. So what's interesting about this is we're teaching an individual to use the most specific spot in the back of their eye called the fovea, and it's what's allowing us to be able to see most distinctly and most clearly, so it's in charge of kind of our critical eyesight and distinct detailed information. So if we have someone who's having problems with binocular vision or two-eyed vision, and we want to make sure they're not ignoring an eye, what's important is to develop the ability to see with that fovea spot really, really well and not suppress it. So this is an awesome activity. We would take them through really basic, big kind of maze first because that's less difficult. Moving on to the really challenging one of teeny tiny stuff where they have to move that spot through. And this is an awesome way of developing good two-eyed vision. So for more information about how we do things at Vision for Life and more activities, go to visionforlifeworks.com.